So I got a text from a major hospital system yesterday, and basically it said they no longer take our insurance effective that day. And I've been thinking about it since then. I mean, I thought about the family member who recently had surgery and was following up with a doctor in that system. And I've thought about other people who had built a rapport with their doctor in that system. Maybe they were working on something, maybe lowering their blood sugar or their blood pressure, or maybe they were working up a condition. And then suddenly they're faced with this unexpected change, which can significantly affect their care. And I thought about the options that people are going to have to make. Are they going to just pay out of pocket, which is incurring an unexpected expense? Are they going to, try to find another doctor? And I wanted to address it because I know there are some people who are going to make a third option, which the other two options, find another doctor paying out of pocket, they're inconvenient, but at least they're getting care. The people I want to address today are those that are going to quietly make that decision to not take care of their health, just to ignore it. So my name is Dr. Lola Ashaye. I'm a board certified family and lifestyle medicine physician and owner of InTouch Primary Care in Sugar Land, Texas. And what we do here is we provide membership-based primary care for people who value thoughtful, unrushed visit, prevention-focused strategies. So I work mainly with adults, especially women in midlife, who want clarity, a clear plan instead of confusion. And our patients come to us when they're ready to stop reacting to symptoms and they want to build real sustainable health. So I wanted to talk about this issue of those that may have gotten a text or those that are just ignoring their health. And because when changes happen in healthcare, many people get frustrated, they feel uncertain, they're worried about delays in getting their care, they're afraid about starting with a new person. And so they just silently quit. And today I want to address this. So if you know such people, please share this episode with them. You can email it, you can text it, and also share, like, comment, because this is what helps more people see this video. So the reason this struck me was I remember a patient of mine who silently quit on her health a few years ago. By the time I saw her, the time I was seeing her at that time, this was almost 20 years ago, she had had major complications from diabetes. She was blind in one eye. She had severe heart disease. She was in and out of the hospital. She was constantly in pain due to nerve damage. And she had depression, she had anxiety. And every single time I saw her, which is a lot because she was always in the clinic or in the hospital, she would express regret for not taking care of herself or ignoring her health. And that really made a lasting impression on me. More so because I could go back in time and look at her health record. And when she started off seeing us at that clinic, her A1C was 6 point something. It was pre-diabetes, right? So what she had was easily preventable, easily reversible, but probably because she felt fine, she just ignored it. And now, 10, 13 years later, here we were, seeing her so often, and she was in great pain and suffering. And so somebody may have gotten this text message, and maybe you are like, you know what, I'm fine. And you've quietly decided that means you're going to ignore your health. Please don't do it. It's not worth it. And maybe it's not just that, your doctor no longer takes your insurance. Maybe you don't have a health plan. And many people don't know there are options for health care, regardless of health insurance status. And that's part of what I want to share today, because when people don't know about these options, sometimes it truly affects their care. So I had a patient when I started this practice 5 years ago, and she decided to come in when she heard that there was this option. And she had a very high deductible. And so, because of that, she wasn't going to the doctor because every time she went, she had to pay. But when she heard that she could do a membership with us, she decided that she was just going to, do the membership. That way she can come in as often as she needed and not have to worry about paying every single time. She knew exactly what she was going to pay, and she liked that. Well, it turned out she came in for abdominal symptoms. And when I examined her, it seemed to me that she had pelvic symptoms, not abdominal symptoms. So she was convinced she had diverticulitis. Well, come to find out after more testing, she had ovarian cancer. So this was someone that was thinking she was fine and she was going to ignore her health if she did not know that she had a different option for care until because we sat down, we talked about it, because we spent time, listening and figuring out what was going on, we were thankfully able to, catch that condition early enough where she was able to do surgery and go through treatment and is fine now. So I share these stories not to scare anybody, but just to help people understand that ignoring your health is not a good option. And there are ways to take care of yourself, even when the system doesn't makes it more complicated. So I want to share a little bit more about our practice and direct primary care. That's the model of care that I practice here at InTouch Primary Care. So, direct primary care, also known as DPC, is basically like a gym membership for healthcare. So, you pay a flat fee, and once you pay that flat fee, you can go in to see the doctor as often as you want. And one of the greatest advantages I see from DPC, it's not affected by insurance. So, for example, at InTouch Primary Care, which is my practice, we don't process your insurance at all. So, if there are any changes, let's say your job changes the health plan, let's say you stop working or you're starting a business, and so now you don't have health insurance, that doesn't affect your care here. You're still able to see your doctor like normal, and nothing changes on our end because we don't process your insurance in the first place. So that's one advantage. Another advantage is that you get more personalized care. So I've seen a lot of people and they complain, my visits are so rushed in the traditional care system. And that's because of how the system is, because insurance drives that system. And so it's a volume-based system. You have to see a lot of people in order for it to make sense. Well, because insurance doesn't drive our system in direct primary care, we have the ability to slow down, relax, really figure out what's going on with you and help you, feel well faster and better, right? So we're not only not rushing your visits and addressing your concerns, we're also being proactive about your care. So, like, for example, in our practice, we send health summaries to our patients periodically. We want to let them know not only what's going on with them for what they came in for, but their overall health picture. Like, what should they be looking out for? What are the things they should be working on now to lower their risk of future health conditions? So that's also very, very important. And that's something that often gets neglected in the traditional care system because there's just not enough time. The other thing that I will highlight that DPC's practice and generally speaking, is you can get it so much easier. So once you become a member, you can see your doctor the same day, next day. And if you can't come in for a physical appointment for any reason, you can call, text, email your doctor. And don't confuse that with a portal message, because a portal message is one that often a staff is answering, not your doctor. This is pretty much you're having a visit with your doctor over text, over the phone, or over email, over video. That's very different, where your concerns are actually addressed. So by somebody that knows what's going on with you. So very, very different level of care. So if this sounds like, okay, this is interesting, never heard of it, I want to know more. Who can use this? Well, you can have insurance or you don't have to have insurance to use a DPC practice. It's not based on your insurance status at all. It's just if you are a person, maybe you're tired of switching doctors and you just want to find a doctor you can trust and you want to stick with them, DPC is perfect for you. Maybe you're tired of feeling dismissed. You want answers. You're just going from person to person. They're referring you from place to place. You want long-term solutions. You're tired of short-term quick fixes. DPC is perfect for you. Or maybe you're just trying to get your health on track. You're busy with other things. You want someone to help you kind of put everything together, make it make sense, right? You want to become healthy. You want to stay healthy. DPC is perfect for you. So, if you got that text, or if you have quietly quit on your health because it seems too complicated, I just wanted to let you know about this option. You can have access to high quality healthcare. You can find a DPC practice by going to the DPC Mapper, and we'll put the details in the caption and just Google it. And if you're in the Houston area, you can check us out at InTouch Primary Care. You can schedule a free 15-minute consult if you want to learn more about how things work. And, you can go from there. But what you shouldn't do, and what I hope anybody listening doesn't do, is don't ignore your health. Your health conditions, even if they're quiet, they keep they're there in the background. They don't go away. And unfortunately, oftentimes they just get worse over time, get more difficult to treat, get more complicated. So whatever you can do now, do it. Don't wait. Okay. So if this has been helpful, please like, subscribe, share with someone who's trying to figure this all out. And that will go a long way from them. You never know. It can truly, truly make a difference in their lives. So your health is so important. If you get all your goals, you have huge dreams, you get all the money. If your health is not there to support all of that, it really doesn't matter in the end. So prioritize your health today. I hope that helps.